shorten up the introduction. We can get on with the evening. It's really a pleasure to be here and see such a great crowd. They actually moved it out of one room into this room because they knew they were going to need more space. And I think what it says is that there are a lot of people who are interested in this issue. And, it's a pleasure to be the honorary chair of this chapter since its inception in 2005, and I've generally been here except when congressional business kept me away from it. I'm pleased to be here because there are so many able and activated activists here tonight. I'm especially pleased to be here with Quentin Young. Dr. Young, who was here, both came from Chicago, University of Illinois, and Cook County and all the rest. He's a little older than I am, but he's been fighting for it even before I got to medical school, and I'm very pleased to have him as an ally during the 93-94 efforts to this Quentin, and he didn't quit. One thing you learn about this business is if you quit, they win. Yes. And Quentin's tenacity, I think, is the greatest testament to what has to happen as we try and change this system in this country. Now, I've introduced, as you heard here, my HR 1200 since I got to Congress. It's basically a single-payer system, state by state, with national standards and national financing, but let states develop their own mechanism. The reason for that is very simple. I was in medical school when the most famous Canadian in all history was Prime Minister of one province, Saskatchewan. His name was Tommy Douglas. Tommy Douglas started with one province and spread it across Canada and made it ultimately happen in the whole country. And it is a model that I still think is the way it's going to happen in this country. I do not think it's going to happen from Washington, D.C. I wish it did, but I've been there long enough and I listened to enough people to realize that what's going to happen is it's going to happen state by state. Now, I particularly was disappointed when the president came into office and immediately took single payer off the table. Yeah. When you saw that, you realized that it wasn't going to happen nationally. And I think that whatever his reasons were, he'll have to explain to you, but I think he was wrong. I think it should have been kept there. Probably not. And our own Dr. Flowers, Margaret Flowers, raised hell in the Senate Finance Committee about its refusal to hear witnesses, a single witness about single payer. They wouldn't even listen to it. And in my view, that tells you the resistance at the national level, so we're going to do it at the state level. We also decided, however, that we had to work with the president to get as much done at the national level as we could. My colleagues on the Ways and Means Committee and the Progressive Caucus, it was hard. It's hard to give up your ideal and be very pragmatic, but that's what we did. We said we're going to get everything done we can with this mechanism that we've got in front of us. And they say politics is the art of the possible, and the Affordable Care Act is clearly that. It is not a perfect piece of legislation by any stretch of the imagination. But in spite of the shortcomings, perhaps the greatest step forward was made in 100 years of our trying. We got to the beaches. It was D-Day. We got on the beaches. Now, we didn't have very much of the country yet, and we've been fighting to stay on the beaches ever since, as you can see from this last session of the Congress. The attempts to repeal the Affordable Care Act come day after day after day, and we've had lawsuits all over the country, and about March 16th or 17th, set some time aside to watch and listen for the proceedings in the Supreme Court. The case is going to be argued, and it is my belief that it's very hard to think that ultimately are not going to affirm the right of the Congress to control 1/6 of the economy of this country. If they say that we have no control over it and it can run wild, the free enterprise system can go without it, I think we are in serious trouble, because the economics will force a change in what's happening in private insurance, either by replacing it with a single-payer plan or by tightly regulating private insurance companies. Some countries have gotten to universal coverage by a sort of a utility method, the same thing we do with our utility prices through our utility commissions. You can do it that way, or you can do it through a single-payer system. If you watch and read the newspapers, occasionally you find some truth in them. Not every day, but every once in a while. But there's a recent article by Zeke Emanuel, who is in the New York Times a few weeks ago, predicting, he's a physician, I was in the White House, in the Obama White House, and he predicted that private insurers will be extinct by 2020. I don't know if the insurance company's going to be like the dodo bird or not, or a carrier pigeon, but the fact is that that's Zeke's point. Now, there are others who think that, Aetna's CEO, Mark Bertolini, embraced this prediction in a speech last week and admitted that insurance companies would have to change radically to merely survive in the post-health care reform era. They know it in the industry. They can see us coming. And don't ever lose sight of the fact that they recognize we're out there and coming for them, because they recognize it, and this is one of the most lucrative providers of health insurance in the country, and he's willing to say something like that in public. So what's next? Well, with the current political climate in D.C., it's clear to me that single-payer advocates should focus on the state level. I think they're going to be working as they are in Vermont and as they have in California. I recently had a long talk with Governor Schweitzer of Montana, and he said, "Jim, can you believe it? If I had all the federal money coming into the state of Montana, I could do the same thing they're doing in Saskatchewan, right north of me. I could cover everyone if they just give me control of all the federal money that comes into the state of Montana." So there are people out there who are thinking this, and I expect that the states shouldn't expect the Congress to be very helpful very quickly, but I'm working on a bill to make it possible for the federal government to give waivers to states to do their own single-payer system. The idea behind the bill is to funnel dollars from all the federal health care programs directly into a participating state, remove the legal barriers, ERISA and others, that block a state from operating a single-payer system, and impose outcome goals to ensure that the state achieves the necessary benchmarks both in coverage and in quality. Now, some of you remember, or there's probably a few gray hairs in here, who remember that we started the basic health plan back in 1984 in this state. I wrote the bill, and Governor Gardner signed it, and we put it in place at Country Doctor in 1984. But the reason it is not a single-payer system in this country, or in this state, is that ERISA prevents the state from getting large employers into the system. So the bill that we're putting together will give this pathway, a legal pathway, so that places like Vermont and others will probably be able then to launch a single-payer system. Now, they can do some things. They can be more unified. But without some changes in federal law, they are going to have a very difficult time. And in my view, the Canadian experience is really worth remembering. Their system started in 1947. And in one province, as I said, in Saskatchewan. And it wasn't ratified until 1967. 20 years later, it took to progress across Canada. Started in Saskatchewan and British Columbia, and then there were several others, and finally the guys in Ottawa said, you know, something going on here. The model for that is you're seeing it right before your very eyes played out right now. That's this whole question of same-sex marriage. It's taking a civil course. Just last year, Maryland, New York, and now, of course, or this year, and the state of Washington have done it at the same time. Full sense of equality will not come until probably there's 10 or 15 states, and then the Congress will figure out, you know something? I think I hear something out there. Maybe we better do something about it. And the dominoes will start to fall. Now, health reform is complex, and regardless of your differences in philosophy, and we all have our own view of what's right in the world, but we really need to work together. We have to work on all fronts, in my view, and I think that this state has had a very vibrant walk-in and other things have worked very well in keeping people aware of the benefits of a single-payer system. And I think that we need to do that as we implement. I believe that the next session of Congress, 2013, when we implement the Affordable Care Act, will be one of the most important sessions of Congress in probably 50 or 60 years. Since 1935, there will be nothing that compares with what happens when we put together the Affordable Care Act and push it out there. Secretary Sebelius is already designing a system, because there's a lot of states that are saying, well, we're going to wait and see what the courts are going to do. We're not doing anything. So there are lots of states that are not prepared. This state is working at it. But Sebelius is ready to take a federal system into those states that have sat and done nothing. So it's going to happen in 2013, and I'm excited to be there in the Congress. We need people like you out in the streets talking about it, going to clubs, going all over the place, speaking everywhere. I really think that this is a crucial time for the democracy in this country. Healthcare is the one last thing that we have not provided in this democracy.
Yes.
We got Social Security, we got unemployment insurance, we got lots of things for foster kids, and we've gotten welfare and all these kinds of things. But healthcare remains the single most disturbing issue. I fly every week to Washington 35 times a year. I started flying in 1988, 24 years ago, and the flight attendants who were flying with me then were 30 years old, and now they're 54. And more than half of those women flying as flight attendants are flying because their husband has a job without health care benefits, and they have to hang on to that job. Not because of the pension, because they lost the pension in the bankruptcies. They haven't had a salary increase in 6 years, but they got their health care benefits. And now recently, as they brought United and Continental together, they said to them, okay, girls, we got a deal for you. We'll give you $2,500 for every year you work for the company. Take your money and go. And all these people said, what about health care? And they said, so they're not leaving. They're not taking it because they can't face the economic insecurity that comes with not having health insurance. So this is an issue, it's going to be dealt with, and it's going to be done by people like you putting pressure on the outside and some of us on the inside doing our part. Thank you very much.